my name's Afroza. I've been asked to explain to you how to use mouthwash. Is that okay?
Yep.
Before we start, can I get your name?
Ahmed.
Are you okay if I call you Tarek?
Yeah, that's fine.
Okay, and your date of birth, please.
20th of March 2004.
Great. Okay, well, I'm one of the healthcare assistants here. I'm going to explain the mouthwash. If you want me to stop at any time or repeat anything, please don't hesitate to do so. Okay? We go at your pace until you fully understood. At the end, I'm actually going to get you to teach me how to do it, and that's not to put you on the spot. It's really to show that I've done a good job. All right. Before we start, also, can you tell me, has a dentist explained to you, or do you know anything about using a mouthwash?
I mean, not really. I just know that it's good for my gums.
That's right, yeah. It's to reduce bacteria, and that's going to help with your gums to reduce inflammation and help the healing. All right. So let's start from the beginning. A lot of these, all these bottles, they'll have the instructions on them, but I think it's helpful to go through it quickly. All right. So you get your bottle, okay, and you take off the cap. Now the cap can be used to measure how much of the mouthwash you need. For you, it would be 10 milliliters. Do you know how much 10 milliliters is?
Yeah.
Okay, good. And there'll actually be a line cap so you can measure how much 10 milliliters is. And what you do, you take that cap, you use it like a cup. So you put it in your mouth, using it like a cup, and you swirl the mouthwash around your gums. Okay, make sure they're fully coated. Clear so far?
Yep.
Do you want me to go over any other
Yeah.
steps? Okay. And once you do that for about a minute, so you might want to have your phone or a timer there, you just spit it straight out. And essentially, that's it. Any questions you have for me?
Yeah, do I have to rinse my mouth with water?
Okay, please don't use water because that's going to make the mouthwash come out, essentially. So nothing to eat or drink for 30 minutes. Anything else?
Yeah, are there any side effects
Oh,
at all?
yeah, that's a really good question, actually, because a lot of these later bottles and medications, you see a whole host of side effects, and I don't want you to be alarmed. They have to list all of the possible ones. It's very rare. At the most, you might get a mild staining of the teeth, or you might get a little bit of irritation or a change of taste. If any of that happens or concerns you, just contact the dentist again. Um, Severe allergic reactions, so if you get something like difficulty breathing or any swelling or really severe irritation, then point to the dial 999. Or if we're here, just give us a shout as well. Is that okay?
Yeah.
Any other questions?
No, that was it.
Okay, good. One thing I did forget to tell you is don't brush your teeth as well. Similar to the eating and drinking, wait 30 minutes because it stops the mouthwash from working. All right. Well, hopefully I've done a good job of explaining that. Can you teach me how to do it?
Yep, so I just get the bottle, get the lid, or 10 milliliters using the lid, and swirl it around, gargle in my mouth, and then spit it out, and don't rinse with any water, don't eat or drink for half an hour, um, and that's it.
Great, remembered a lot of information so quickly. Thank you. The other thing, did the dentist tell you how often to take it?
No.
Okay, that's fine. Usually it's one or twice a day, so I'm going to ask your dentist what he wants for you, and I'll just go and get permission. All right. And well, thank you for coming today and taking the time. And any questions, just come back to us.
Okay.